Hi everybody, it's me. It's Dr. Kestler from Lorain County Community College, and welcome to the first co-video in June. We've been doing these for a couple months now. Um, and so I want to talk a little bit today about, well, there's a bunch of things I want to talk about. I'm going to talk about some medical stuff and a little bit of everything here. First of all, my temperature today is 97 degrees, and that is 36.1 degrees centigrade. And so I'm feeling pretty well. I do leave the house. I'm going to talk a little bit about leaving the house and trying to get back into things a little bit today, as well as a few other things. First of all, I want to mention something that a little update on Remdesivir, and this is the drug that is on trial right now, and it seems to be very helpful in all kinds of cases. In people who are in every situation, application of the drug seems to be very helpful, whether you're um, no matter what state of affairs you're in, and so that's a very encouraging kind of thing. One of the things that we have done and I'm going to go back to something that I began with, flattening the curve. The first day I talked about flattening the curve, and one of the things that has benefited us tremendously is that this has allowed physicians, this has allowed scientists to develop strategies for helping people more. And that certainly is the case. And so Remdesivir is one of those stories. I want to talk a little bit about Russia. Uh, and we have information here, and I have to tell you something about governments in general. Governments. I've been studying infectious disease for a long time, and I will tell you this: the governments love to lie about facts. But I've been perplexed, and I think you've heard me muse about this in the past, that the low number of death rate from Russia. And if you look at this data here, you can see, we've had over 100,000 people succumb to COVID-19 disease, and Brazil is currently on track to have a big problem with COVID disease. And then you get down to Russia, and you see there's there's a lot of cases. There's the third most amount of cases, but there's very few deaths. And I've been starting to hear a few reports come through that there might be a reason for that, that they are actually suppressing the death count, which makes them appear healthier and in general, and makes them appear more resistant. But I will tell you this, that as I mentioned, governments have always lied about disease. I remember one time Africans were saying there's no AIDS in Africa because it would suppress tourism. China also lied about AIDS in the past. And the fact of the matter is that always gets corrected. The truth always comes out. So it's a temporary lie at best. So we will see in upcoming days what happens. And we're already starting to see, like in Moscow, there's 1,700 cases, extra deaths that are not explained, and that's just one city. So I think that is a big deal. All right, now I want to tell you about flattening the curve, and I want to tell you about the herd. And of course, you guys know that herd immunity. Herd immunity occurs by two things. One is people actually getting it, or the disease and recovering. People getting the disease and passing away, and getting the disease or not getting the disease because you've taken a vaccine, some sort of a preventative measure. We are a long way from getting towards herd immunity everywhere in the world. About the lowest percentage you need for herd immunity, and just to let you know what that means, is that you want to get enough people, that the people that you encounter, let's say going to the supermarket, and this little figure here shows you little dots. So the little dots, you want to not have to run into one of those little dots. And if you get it down low enough and people don't get close enough, then you can certainly get it. But it remains to be seen what is necessary for herd immunity in COVID-19. But let's take an estimate of about 60%, and we are only about 20% in one place, and that is New York City. New York City is the only place where we have anything approaching that. We have an estimate, looking at antibodies, looking at actual hospital data, of about 20% people of the population. Obviously, we'll need more people to be able to get through that. We also need to, and I've just included a couple of different pieces of data about where we are in various cities, even in Barcelona, which is a city which is in Spain, where Spain had a tremendous number of cases. So going back to work, there is a little chart here about going back to work. This came from, I think, the New England Journal, about what your risk is, and there's low risk, high risk, medium risk, and you behave accordingly. As you go out into the population, you need to make decisions about how you will behave. I don't think anybody is going to be close talking anymore. That is not a thing that you want to be doing. But you are going to go out, and depending on your risks, you're going to take precautions. Anyone who gets sick should stay home, just to keep that out of the picture, and not return to work till you test negative for the virus, but positive for the antibodies. That's the kind of thing that we're looking at here. So this is the ABCs of risk level, from low risk level to high risk level, and the kinds of precautions that one should take with respect to masking and isolating, etc. There are still some people that should. In addition to work, we have to, obviously everybody works, but we also have to play. And I was interviewed for the Plain Dealer over the weekend, in a story about what kinds of activities are good to begin going back to play. And I will remind you that the caveat that I put with all of my evaluations is that you need to be a consumer of safety. In other words, you need to go into some place and say, I like the way that these people are doing their precautions. I will return here. Or I don't like the way that they're handling the situation. I choose not to go back here. So you're going to go out into the world and you're going to make those kinds of decisions. And of course you're going to mask up when you have to. Of course you're going to wash those hands and not touch your face as you go out. Those are very important things, and that will continue as we go forward. But these are the kinds of things. If you go into a restaurant and it doesn't look very safe, there are many people crowded around a bar, my choice would be to turn around and leave and go to a different place where maybe they take the safety a little bit more serious. One of the things that I can tell you about all of this is that if you look at the this is a heat map. I'm looking at this figure with all these places, all these states. These are heat maps. The redder, the more cases are occurring. The bluer, the less. I think you can see in some of the data that there's definitely some ups and downs going on here in the cycles. So as we leave, as we stop sheltering in place, you're going to see more cases occur, and then we should back down a little bit, and then make sure we keep ourselves all safe. Now, one last thing, I can't help but mention something that I just am thinking about all the time, and that is that we should be outraged at the events that happened, at the death of a person in Minneapolis because of his skin color. I will tell you this: that racism is also a disease, And I think that the good thing is that we can create immunity to that disease. We can help prevent that disease. That disease extends into a lot of things, including COVID-19. COVID-19 has exposed huge problems that were there. They're not. There's nothing new. There's no news here. They existed, but we ripped off the Band-Aid and we saw the level of infection going on. Um, so I just want to say, if you are protesting, and I think you should. I think we all should. We all should be protesting right now. Do so safely, especially in large groups. Try to maintain distance. Definitely wear your mask. Um, Protect yourself. Safety is an important thing, and I think that is, and hopefully we'll all be better for this. Um, I just want to talk a little bit about Fred Rogers for a second, and I've had this on every single co-video that I've ever done, and I haven't taken it down. There are helpers out there in both of these epidemics that I'm talking about today. There are helpers out there. There are people who are helping people, and they might be the police. They might be the protesters. There are people that are doing good. Find those people. Find the helpers, and we will get through both of these epidemics, and I think we will emerge better. I think we will emerge much better. I'm going to stop right there and thank you for tuning in today. And I will see you again later in the week. Stay safe, stay well, be good to each other, and may you all persist like a lentivirus. Thank you.